Actually, before I make just a few closing remarks, I want to thank our audience for being so patient, and also to give the audience an opportunity to ask perhaps one or two questions or comments about the session before I give those remarks.
This is Amy Berman from the John A. Hartford Foundation. I want to thank the IOM Study Committee, the IOM more broadly, and the panelists today. It was really quite remarkable. So for all of the value that we heard in the various pieces of testimony provided, I would like to ask one thing related to Eileen Crimmon's first testimony of the day. And the question is that as we look at other countries and when policy enables the payment of supports for family caregivers and people then make use of those supports, one piece of information that I didn't hear that might be helpful in forming the policy recommendations and the action recommendations would be, what is the effect on work, on employment? What then is the employment impact on contributions to the tax base, which then translate to the ability to provide these services? For diverse populations, whether if people are at the lower end of middle class, whether this prevents people from being tipped into poverty. So are we going to have, referring back to Marie Bernard's testimony this morning, if people are tipped into poverty, they are more likely to have all of the greater needs and debility associated with the need for family caregiver supports. So to look at this holistically, the additional piece of information relates to, I guess, economic fragility and what the impact would be on society. So I thank you for your work and ask you to do one more piece.
I think we have time for maybe one more comment, and then I'll make some closing remarks.
Thank you. My name is Liz Schwartzy, and I'm with Ladson Consulting and the Rosalind and Arthur Gilbert Foundation here in Southern California. And I first have to apologize. I kept raising my hand because somehow I missed the instruction that only the IOM study committee was to ask questions, so my apologies, and I thank Amy for alerting me to that. I really appreciate the coming together today of the study committee, and also the comments provided by the panelists and the diversity of perspectives, and just so many questions come up. But I think that I just wanted to raise a point that I think was made by several panelists that has to do with the value of community wisdom. So the telling of the personal experience, and that story is, as valuable as the story that we can tell through research, evaluation, statistics, demography, and so on. And I think many of us professionals in the field, and most of us here today are professionals, that I personally struggle with this all the time, and how to create enough space and opportunity to hear that very authentic voice directly rather than through intermediaries. And so I do encourage the committee, insofar as possible, given the scope of this project, to listen for the direct stories as you formulate your recommendations. Thank you very much.
Well, I think I probably echo what many of you are thinking, which is that this has been a very powerful and informative set of presentations today. And I really wanted to thank the audience, both the audience that's present here in the room and also the audience that's present on the web. But most importantly, to thank our esteemed speakers who really have taken their valuable time to contribute to this effort. We really appreciate their contribution, important contribution to this process. I think it's clear, at least to me, and I think probably I speak for many people on the committee, if not, I think probably all, that these issues of diversity are really central and important in the work that we're doing. And I think that these presentations collectively have really reinforced and highlighted that. If I had to sum it up, maybe it's that there are important similarities, but also differences that matter. I think as we, as Dr. Yee said, as we try to fix the system, I think it's really important to take into account the diversity among older adults and caregivers and to make sure that no one is left behind as we try to make recommendations at the end of this process that hopefully will make a difference. You know, I also wanted to note that in the panel presentations, you probably noticed that we've tried to sort of frame diversity in this set of presentations pretty broadly. Perhaps some would argue not as broadly as we could, but we've tried to attend to issues of race and ethnicity, the LGBT community, urban, rural differences, also gender issues and male caregiving. And we've also touched on socioeconomic status. At the same time, I think that some of the presentations have kind of challenged and reminded us that these categories that we use are somewhat faulty. And I'm reminded of Dr. Yee's presentation and talking about the diversity within Asian Americans. And if we look at poverty levels, the differences between, say, Cambodians or Hmong and Japanese Americans. And Dr. Friedrichsen-Goldson's presentation, I think she also highlighted another important issue, which is that these strands of diversity are often not separate, but they're crossing. And so that's part of the complexity, I think, also that we're dealing with. I just wanted to punctuate sort of this issue of SES as an issue. And I know that, unfortunately, our colleague Laura Trejo could not be here today. And I think, as you can see in the slides that she prepared, she would have emphasized this issue of poverty and socioeconomic disadvantage as a really important part of the context of caregiving for many older adults that disproportionately affects ethnic and racial minority caregivers. You know, I had a very long list of sort of points I wanted to make, but I realized that it's 12 o'clock and lunch is right around the corner. So I just wanted to just highlight a couple of issues. And sort of one of them is that kind of weave together some of the themes and things that I've heard throughout the morning. One is the central issue of the recognition of the caregiver. And I think that that's really, you know, a central, very, very important issue. And as Dr. Benton said, if I can sort of borrow a phrase that she used, that it's not only recognition, but it's also respect. It's respect for the caregiver. And I think, you know, we have to pause there for a minute because it's not the caregiver, but as we've heard, it's often multiple caregivers. And I think that context needs to be taken into consideration. But I also think we have to unpack what we mean by respect. And what do we mean when we say we respect caregivers? And I think as we've heard, that has to do with the values, the preferences, the needs, and the experiences over time of the family caregivers who are being recognized. And as we've heard in these presentations, and is quite apparent, is that this varies based on the different strands of diversity and experiences that people have had. And I think that this raises profound issues for training our workforce, for the delivery of care and services, and I think that was highlighted by a number of the presentations today. I think the other issue that I wanted to highlight is this issue of community that came up a number of times, and the importance of the wisdom of community, the importance of community agencies. That often when we think about marginalized or underserved caregivers and populations, that sometimes, for example, they may have a stronger sense of trust in those community agencies than they may, say, with the healthcare system. And so I also think that thinking creatively about how we bridge bridge between the community and sort of the clinic and healthcare system, and use the community as a resource to help activate caregivers and educate them and help them really advocate for the best possible services for their loved ones is another kind of important area and theme that I heard sort of running throughout some of the presentations. So I think I'll end it there, and thank you all for your participation, and hope you have a good lunch.